Hi, welcome to another edition of What's This Show For? FOR, Friends of Ron. I'm your host, Ron Levitsky. Autism is really more of a difference to be worked with rather than a monolithic enemy that needs to be slain or destroyed. This is a quote from Dr. Stephen Shore, professor of special education, who himself is autistic. Well, if that's true, if this is something that needs to be worked on, how do you work on autism in specific everyday situations? For example, like going to the dentist. Well, today we're going to take a look at just that with two fascinating people who know a lot about the subject. I'd like to welcome today Kristen Scott, a parent and a blogger, and Dr. Jeffrey Canner, pediatric dentist. Both of you, thanks so much for coming on the show.
Pleasure to be here.
I want to start off by saying, both of you, Kristen, we've been on the township board of West Deerfield Township for a while. Mm-hmm. Got to know each other that way and socially as well. And Jeff, you and I have been friends for quite a while and admired your work with autism. So I think it's delightful that you both are on the show and we can utilize your expertise. Let's start off, if we can, Kristen, by sort of trying to tackle this very difficult subject as to what is autism. People hear the term autism, they hear about the spectrum. So what do we mean by autism?
Well, autism is a spectrum disorder that affects primarily communication and behavior. It is called a developmental disorder because it is most frequently diagnosed, although it can be diagnosed really at any age, in the early formative years, up to 2-3 years old. The spectrum refers to just the vast differences in behaviors and symptoms and the impact the disorder can have on the person who has it.
When you say that it could be diagnosed when a child is rather young, what would be some of the manifestations?
Lack of eye contact, not looking, lack of language coming in. That was one of the big indicators for my son at his 1-year checkup. That was the red flag that my pediatrician noticed and asked us to go for further testing. Rigidity in the way a child will play, not playing necessarily with the toy, but insisting on playing with the box and only the box. Certain ways of demonstrating their emotions, not necessarily wanting to be cuddled. I'm telling you most of what happened to me, but there are just a wide range of things. Toe walking, just unusual behavior.
And where does Asperger's fit in?
Asperger's refers to very high-functioning autistic people who are, and that term is sort of not even being used anymore. It's sort of being phased out. It's just a part of the larger autism umbrella. But people with Asperger's syndrome can go to school, go to college, can hold down jobs. My nephew, for instance, went to college, has a job, is getting married in July, and he would be defined as someone with Asperger's syndrome.
Okay, and then what are some of the pressures on the family with a child with autism?
I don't know where to begin. There are many, and again, it does make a difference to how your child is affected. But any special need is different for a family. Back when my son was diagnosed in 1994, we did know where to go. We were told to go to Northwestern University, but nothing was covered by insurance at that time, so it was enormously expensive. And fortunately, we had help from my dad. I don't know how we would have done it. People go into debt. A child whose behavior is unpredictable makes it very difficult to go out into the larger community sometimes, or to know how to react, and you end up feeling very isolated because you see your friends' children developing typically, and you might feel envious, or you don't even want to look at it, and if you have another child, that impacts the other child as well. So
right, yeah, and you had one who didn't have autism.
Yeah, my daughter's 2 years older than my son.
And Jeff, how did you become interested as a pediatric dentist in autism?
In 1970, when I was a sophomore going to my junior year in college, I was looking for something to do in the summer. And then you could actually do something meaningful. There were no internships. You did have to worry what this was going to look like on your resume. And actually, money was not that much of an issue either. So I went into this little room in the small college that I went to. There was no computers, nothing. You just walked through and you looked for little pamphlets. And I saw one that said Ramapo Anchorage Camp for exceptional children. So I was always interested in children then, and I pulled it out, I read about it, and I applied. And lo and behold, I was hired as a lifeguard. I had taken water safety instruction, so my guess is that there wasn't a lot of people who wanted to teach children on the autism spectrum how to swim, although at that time, that term was never discussed.
I mean, were kids called autism? No, they weren't.
No. Autism was first discovered in 1943, and this was 1970. The word had not gotten out. Even in a school that caters to children with special needs, they were considered exceptional children.
Okay, so that was a term that was used, exceptional.
Yeah. In the schools that fed into this camp, and there were some pretty well-known schools. The League School in Brooklyn, which was very well known at the time, but they were not we used to read the medical histories. You know, we were on night watch, and you just pull out the files, and you read all about the children. And autism was never mentioned, but there were definitely kids with autism.
Okay, well let's then jump ahead and talk a little about your specialty here, the dental care for children with autism. Kristen, do you remember when you first had a dental experience with Daniel, whether it was at home with brushing his teeth or taking him to the dentist?
I can't really remember the first time we tried to take him to the dentist, but I can almost guarantee you that it was not a success. And teaching him even to brush his teeth was a battle. I remember the joke became, "Spit, Daniel, spit, Daniel." But my neighbor and my dentist recommended a pediatric dentist who he had heard speak at the ADA convention about his ability or his success with dealing with children with special needs. So I saw this guy, and he was in the city, fortunately the north side, and Daniel had a number of cavities. And I'd been told prior to that he would have to go into the hospital, undergo general anesthesia for them to work on his mouth because he would not hold still. And that just seemed overwhelming at the time. So we tried this guy, and it worked out. And I did not go back into the room, but I didn't hear any screaming or anything. And they were able to examine him and deal with the cavities that he had. This is probably 6 years old.
Do you know what techniques they used?
No, I really don't know. And they did not want the parents to go back there. And I think with my son, that was probably the wise decision because I would have distracted him. I asked them, "Are you tying him down?" And no, and he wasn't. He didn't seem distressed, and we were able to do that a number of times. Of course, there were times that I took him, and it did not always go well. But he became our dentist until Daniel moved away from home.
Okay. And Jeff, I should ask you, how does a pediatric, I know you deal with children, but how does a pediatric dentist techniques differ from one who basically works with adults? Or is there a major difference?
Well, first of all, a lot of pediatric dentists actually want to see kids with special needs.
Really?
Yeah, this is why you go into it. You know, so if someone like Daniel comes in, it's not like, oh, this kid's got autism on my schedule, how am I going to get through this? Say, this is going to be interesting. Let's see what we can do. But at the same time, I'm not going to make any promises to the parents. If anything, I'm going to try to decrease the expectations. First time around, if a child will get into the dental chair sometimes, and then let's look at his or her teeth without having major anxiety, that's, successful. But I would call the parent, usually it's the mom, if a child with autism is on the schedule. We usually screen for if there's a disability. Most people will say that there's a disability on autism nowadays. In the past, nobody would say. They would not say, my child's got autism. They would have put it down on the medical history. You have to figure it out for yourself.
Okay, let's get into it in a moment, but you said something to me when we were preparing that really intrigued me, and that is that you had gone to some conferences, and the parents had all sorts of kind of unusual, maybe for the time, questions, or ones that maybe you hadn't expected, parents of children with autism. What were some of the kinds of questions when you would go to a conference that parents would be very concerned about?
Well, parents are always trying to figure out what is wrong, what can I do? So there were many issues with autism, I think, and they are still talked about today. One was amalgam. Silver amalgam, the silver fillings that dentists use for decades, contain silver and mercury. So that's what amalgam is. Amalgam is a combination of a metal and mercury. The mercury is a neurotoxin.
Neurotoxin meaning?
Meaning that it is detrimental to the nervous system.
Okay.
And then the controversy was, is the silver amalgam stable, or is some mercury going to leach out, especially under load? In other words, you get the filling, and the load is the teeth meeting each other. So small amounts of the amalgam would be worn off, and maybe some of the mercury would vaporize. And if it vaporized, then it would be ingested or inhaled, and children with autism are thought many times not to be able to break down heavy metals and other potential toxins like mercury, and it's actually going to make the child worse.
So the idea is that mercury would not necessarily cause autism, but it would aggravate a child who had autism.
Exacerbate it, right. Because some of the early work in autism involved parents, especially the dads, who worked in the chemical industry. And there's a disproportionate number of children of those parents who had autism. This was by the founder of autism. His name is Kenner, Kenner. And then Asperger, this was 43, maybe in 1944, Hans Asperger in Europe came up with Asperger syndrome.
Were there any other questions besides dealing with mercury amalgam? Anything like with anesthesia?
Fluoride.
Fluoride.
Fluoride has been debated since the first fluoridation studies in the 40s, and you don't have to be on the autism spectrum to believe that fluoride is a toxin, and it's even worse with children on the autism spectrum. A lot of people thought that fluoride was going to be detrimental to the child because they can't metabolize it, that it would stay in the body, especially in the brain, and make the neurological problems that children with autism have worse, because very often children with autism will have seizure disorders or problems with their eyesight or perceptions. So that's all central nervous system, that's all brain.
So at a conference, when a parent would bring up questions dealing with mercury and or fluoride, how do you respond to that?
Well, the first time, I think they were so happy to have a dentist there that most of the questions were softball questions. Nobody went there.
Like what?
Does my child have to be put to sleep to have their dentistry done? Or is my child more susceptible to tooth decay? How can I get my child to brush? Anything we could do about the loud sounds or smells? Anything you can do to relax my child? Why does my kid get so many cavities? Does that have something to do with autism? Just basic basic stuff.
And then when they got to the fluoride and mercury,
Never got there.
okay.
Well, I mean,
I
some
would think
people,
that would be a real, parents would really worry about that, especially,
they might worry about it, but you know, they expected a allopathic dentist, somebody who's mainstream, that uses the medications that are mainstream. Figured, what do they know about it? And I'm not going to get anywhere debating it. The fact of the matter is, I learned quite a bit as I did these things and learned a lot about it. And then later on, this all came up, including nitrous oxide. That's a big one too. The more people go into autism from a physiological, pharmacological point of view, then nitrous oxide comes up. Well, very few anesthesiologists are going to be able to treat any child without nitrous oxide.
Kristen,
It just has happened.
as a parent, did you have any of these concerns?
I feel as though I should say yes, but really no, they were not.
This came up.
that didn't-
This came up before Daniel would have to deal with that.
Yeah.
I mean-
It was just really getting him basic care. I certainly didn't even know of
No,
these
I don't think
concerns
that
at the
anybody
time,
did.
But, yeah, there are a lot more, as autism becomes more prevalent and more talked about, there are many different angles to take, but those kinds of concerns were not on my radar. They were
Okay.
really more basic.
Yeah, well,
getting him
autism is
to
an
sit.
equal opportunity disease. I call it a disease because I think it is. So that's a whole different show.
Well, let's say a parent walks in with a very young child, 4, 5, 6, whatever. Here, Dr. Cantor, here's my son or daughter, first time visit, my child has autism.
Yeah,
What is,
we would let the mom come into the room. There's no benefit nowadays to, it's got to be transparent. I mean, you took their word for it. The younger moms are not taking anybody's word for anything. You
so
know?
then, how do you, take us through what you might do, just for the first checkup.
Okay. The child would come in. Is the child going to sit in the chair? Maybe the child will, maybe the child won't. Maybe the mom can help, maybe the mom can't. A lot of times, even what we call low functioning, which is kind of a pejorative term, but it means cognitively functioning on, let's say that the child's 12 and they're functioning on a 4-year-old level. A lot of times that's because of communication. It seems like they're functioning at a 4-year-old level, but they could be inside their head, understand a lot more than we might think. Well, this child may be extremely manipulative, get the mom to do anything that the child wants. The mom's not going to be very much help. Or the mom's got this kid figured out and is going to say to the child, it's going to be okay, I'm right next to you. Child gets in the chair, mom holds the child's hands, and then we go into the whole pediatric dentistry song and dance. This is the light, this is the mirror, this is the tickler, this is what you're going to hear, this is what you're going to feel. So some children are hyposensitive, meaning that stimuli, the more pressure, the better, and some kids are hyper, and some kids are both. So you try to get an understanding if they're hyper or hypo. That's where the telephone call comes in very handy. Is the light going to bother your child? Is the noise going to bother your child? Should we have the child come in early so it's the only person there?
Is there like a checklist that this secretary was actually talking to the person and checking off so that as a dentist you know in advance what to expect?
No, I talked to the
You do.
patients and I have my own mental checklist. If I'm doing it so many times, it's like when the anesthesia people come in. They don't have necessarily a checklist. You know, have you had a heart trouble, lung trouble, kidneys, liver, if you had an anesthetic before, if you ever vomited, blah, blah. I mean, they do it every single day. So, yeah, I've got my own list. And the mothers start to talk. You know, I went to this dentist, I went to that dentist, this is driving me crazy, I don't know if he's got a cavity or not. Every time he loses a tooth, it's a big, big deal. I mean, it's like it's a loss. I mean, if a child's used to feeling a certain thing with their tongue and there's a space, it could be a huge deal. Throw the kid off quite a bit.
You had also when we talked earlier, said that kind of conversely, that maybe the child would like the attention.
Sometimes, the higher functioning, the easier it is. The more verbal, the easier it is, because you can use diversion. Oh, how many teeth do you have? Let's shine that light. Let's, count them. Do you have ticklish teeth? Are you married? I mean, all these things you use, pediatricians use, to divert children, get their attention away from what you're, doing. But you have to be able cognitively high enough to know what ticklish means.
Yeah.
But so higher functioning, I always like the smart kids. They're easier to deal with. Smart is the wrong word. Higher functioning kids.
You also said earlier when we were talking, and quoting you, that insensitivity of the dentist is often part of the story.
Yeah, if the dentist does understand, I mean, I would hope now, with all that's been written and discussed with autism, I think 1 out of, what is it now, 40 children's on the autism spectrum, and there's 4 to 1 boys. So that means 1 out of 22 boys, and maybe 1 out of 60 girls. I mean, it's a huge number. Everybody knows somebody that's got a child with autism. You'd like to think that everybody knows and doesn't think that the child is spoiled or lousy parenting. But
Have you ever had somebody come in with a child with autism and the parent not know it?
no, they just won't. Yes, many times.
Really?
Yeah, or they sort of know it, but they don't want to admit it. I mean, denial is rife. I mean, especially with the dads. They don't want
We're
to accept
looking
it.
right now to Jeff's email address and also Kristen's superb blog called Good Marching, which I really encourage you to take a look at. Let's talk a bit now about child grows up.
Okay.
So Kristen, now Daniel's an adult, what are the issues that he might face with the dentist?
Well, probably the same kinds of issues he had from the beginning. He will not cooperate, and now he's bigger and
The big
stronger.
guy.
Daniel has lived in a residential school or home since he was 15. So he's
And he's
been
now?
27.
Okay.
So 11 years, over 11 years, he's been away from home. And he's been taken to the dentist by his team. But now he seems to be used to it, and it's typically an okay experience for him. And so I can't speak to that as much, but I have a close friend who, when their son needs to go to the dentist, it's an all-day ordeal where they'll need 7 people just to hold him down to administer general anesthesia so he can have his mouth examined. And that's not even including anything that would have to be done. So it can be quite an ordeal as the child gets older, becomes bigger and stronger. Like, my son is 6'1". There would be no way I could do it, but
Right,
you
right.
can maybe speak to that more than I can.
Well,
but I don't know how.
in
Do you
the-
follow your children? Your
Oh, yeah. Yeah,
patients as they
in the
become
dentistry
adults?
world, pediatric dentists see children with special needs, and they keep seeing them. Very rarely are they going to go to a general dentist unless they do extremely well. Back in the day, kids were on polypharmacy, many, many drugs. I didn't think that they helped at all at the dentist, maybe made it worse. But they're learning, so sometimes they can titrate the medicine, and the children will be much calmer. Now, they may be pharmacologically sedated. I don't know what it feels like inside their head, because sometimes a lot of medication can make you extremely dull and tired. But it can help, especially someone who goes the pharmacological way, or maybe changes diet, or works on behavior modification techniques, socialization. I mean, this is why it costs a fortune, because these things are typically not covered by insurance or only partially, and your child could have 6 or 7 therapies and be on a special diet and take all kinds of medication, because they could have seizures, they could have communication disorders, that's, speech, so you got the neurologist, you got speech, you could have hearing, you could have vision, you could have allergies or replete, you could have gut issues, just, it never ends.
Would it be fair to say that children with autism have more dental issues than those who don't have autism?
No.
No. Because I would think that kids without autism might be better able to do preventative care.
Well, a lot of children with autism just will only eat 4 or 5 things. So if one of those 4 or 5 things, if they're chicken nuggets and they're peanut butter and jelly.
Lemon light yogurt in
Lem-
Daniel's case.
Right. It depends. If they're not cardiogenic, things are good.
I'm sorry if they're not.
Cardiogenic causes a tooth decay.
Okay.
If they are, we're in trouble. And then you get gum disease, which is, let's say the child is hypersensitive and the toothbrush bristles drive the child crazy, which some children can. They get a hypersensitivity hearing-wise. So if there's a faucet dripping in the basement and they're on the 3rd floor, they can hear it. And it'll be very upsetting. So there are always special cases, The expression is you've seen one kid with autism, you've seen one kid with autism, because everybody's different. So it depends. So if the child's got a limited diet and it's not going to cause tooth decay, we're good. It's just a matter of working on the brushing. And it depends on the parents. Some parents, that kid's teeth are going to get brushed. If it takes 2 of them and climb all over the kid, and if you start young, the child knows. Just because communication is not great doesn't mean these kids are stupid. They know when the parents really mean business. But if it's not always the case, if the child hates it that much, they will fight, and when they get to be 6'1", forget it.
It sounds pretty daunting, both obviously the parent perspective, but also the dentist. If a young dentist, they say this show was being shown at dental school with a bunch of young dentists. What advice would you give for someone who wants to be a pediatric dentist and is thinking about working with children of special needs? What do you tell the person?
You better like it. If you don't like it, it's going to be onerous. It's going to be, you're going to fear it. Your blood pressure is going to go up. Can't wait to get the kid out. I mean, but the bottom line is not every child with autism has got horrible dental problems. And if they do, it's probably going to be general anesthesia. If you got to do a lot of cavities, you want to do them well, you want to do them once, you need cooperation. But if the child's got one little one, or sealants, or just cleaning the teeth and putting in fluoride, you play the long game. You see a child at 3, I'm okay if we don't do a good cleaning, the child's 10. I mean, children, periodontal disease takes a long, long time.
Well, unfortunately, we don't have a long time.
Okay.
We're out of time. We're out of time. Dr. Jeff Kanner, pediatric dentist. Kristen Scott, parent and a wonderful blogger. Good marching?
Good marching.
Good marching. Thank you both. Hope you've enjoyed it as much as I have. This is Ron Levitsky saying, see you next time for what